Governments have always claimed they act in our best interest. But behind closed doors, some cross lines that should never be crossed. Today we're examining the most disturbing government experiments ever conducted on unwitting citizens. From mind control programs to biological weapons tests, these are operations that were declassified, exposed, or leaked, proving that truth is often darker than conspiracy. 10 experiments, 10 violations of trust, all of them real. MKUltra. The CIA launches Project MKUltra in 1953. Director Alan Dulles approves the program with one goal: develop mind control techniques that could be used on Soviet spies and prisoners of war. The agency recruits chemist Sidney Gottlieb to oversee what becomes the most notorious mind control program in American history. The experiments begin with LSD. Agents dose each other at CIA headquarters, slipping the hallucinogen into coffee and cocktails without warning. One biochemist, Frank Olson, plunges from a 13th-floor hotel window in 1953, 9 days after being secretly dosed. The agency calls it suicide. His family suspects murder, but MKUltra expands far beyond CIA offices. Gottlieb recruits doctors, universities, and prisons across North America. At least 80 institutions participate. Researchers dose patients at mental hospitals. They experiment on prisoners. They target vulnerable populations who can't consent and won't be believed. In Montreal, psychiatrist Donald Ewan Cameron develops psychic driving. At McGill University's Allen Memorial Institute, he puts patients into drug-induced comas for weeks. He plays recorded messages on loop for 16 hours a day. He administers electroshock therapy at 30 to 40 times normal power. His goal is to erase existing memories and rebuild personality from scratch. Patients arrive with mild anxiety or depression. They leave incontinent, unable to recognize their children, with memories erased back to infancy. One woman forgets her wedding day, the birth of her children, her entire adult life. Cameron receives over $69,000 from the CIA. His patients receive no warning. They're test subjects. In Kentucky, federal researchers pay black inmates to consume LSD for 75 consecutive days. The men receive heroin as payment. At Lexington Narcotics Hospital, Dr. Harris Isbell runs from 1952 to 1963. He tests dosages far beyond what researchers considered safe. He keeps no records of long-term effects. The program runs for 20 years. It spans 149 subprojects. Then in 1973, as Watergate investigations intensify, CIA Director Richard Helms orders MKUltra files destroyed. An agency official burns thousands of documents. Only a fraction survived due to a filing error. But in 1975, the Church Committee investigation exposes fragments of the program. The CIA admits to dosing unwitting Americans. They admit to funding brutal experiments. They admit to violating the Nuremberg Code established after Nazi experiments. MKUltra remains the definitive proof that the U.S. government experimented on its own citizens without consent, destroyed evidence, and denied everything until forced to confess. Tuskegee Syphilis Study. In 1932, the U.S. Public Health Service begins a study in Macon County, Alabama. Researchers tell 600 black men they're receiving free health care. It's a lie. The real purpose is to study the progression of untreated syphilis. 399 men have syphilis. 201 serve as controls. None are told their diagnosis. Researchers tell them they're being treated for bad blood, a local term for various ailments. The men receive aspirin and iron supplements. They receive no treatment for syphilis. The study is supposed to last 6 months. It continues for 40 years. In 1947, penicillin is the standard cure for syphilis. The Tuskegee researchers don't provide it. They actively prevent participants from accessing treatment. When World War II draft boards offer antibiotics to syphilitic men, researchers intervene to exclude their subjects. They ensure the disease progress is unimpeded. The men suffer tertiary syphilis. The infection spreads to their hearts and brains. They go blind. They develop dementia. They die from organ failure. Their wives contract the disease. Their children are born with congenital syphilis. By the time the study ends in 1972, 28 men have died directly from syphilis. 100 die from related complications. 40 wives are infected. 19 children are born with the disease. The experiment only stops when Peter Buxton, a public health service investigator, leaks details to the press. The Associated Press breaks the story in July 1972. Public outrage forces the government to terminate the study immediately. In 1974, the U.S. government pays $9 million to survivors and families. In 1997, President Bill Clinton issues a formal apology. He calls it shameful and racist, but no researchers face criminal charges. The Tuskegee study remains the most infamous example of medical racism in American history, and the reason many black Americans still distrust public health institutions. Operation Sea Spray. In September 1950, a U.S. Navy minesweeper cruises just offshore of San Francisco. For 6 days, the ship sprays clouds of bacteria over the city. 2 bacterial species, Serratia Bacillus globigii. The Navy considers them harmless. The purpose is to test how a biological weapon attack might spread through an American city. The military conducts the test in secret. 800,000 residents are exposed. No one is warned. No one consents. Within weeks, 11 patients check into Stanford University Hospital with rare serratia infections. One man, Edward Nevin, dies. His infection is directly traceable to the Navy's bacteria. It's the first recorded death from serratia marcescens in the Bay Area. The military denies any connection. They continue similar tests across the United States. Between 1949 and 1969, the Army conducts 239 secret biological agent tests over populated areas. They spray bacteria in Minneapolis. They release particles in subway systems. They test dispersion patterns at Washington National Airport and on the Pennsylvania Turnpike. In 1977, the Army finally admits to the testing. They release 800 pages of documents. They claim the bacteria were safe. But serratia marcescens is now recognized as an opportunistic pathogen. It causes pneumonia, urinary tract infections, and sepsis, especially in immunocompromised patients. The Nevin family sues the government. A federal court rules the military has immunity. The judge acknowledges Edward Nevin's death, but says national security interests outweigh individual harm. The case sets a precedent: the government can experiment on citizens without consent if it claims military necessity. Operation Sea Spray reveals a pattern. For 20 years, the U.S. military treated American cities as testing grounds for biological warfare, exposing millions to potentially dangerous bacteria, all in the name of Cold War preparedness. The Plutonium Files. Between 1945 and 1947, doctors inject 18 Americans with plutonium. The patients don't know. Most are terminally ill. Some are not. None can consent. At the University of California Hospital in San Francisco, doctors inject plutonium into a railroad porter with terminal bone cancer. At Billings Hospital in Chicago, they inject a woman after an automobile accident. At Oak Ridge Hospital in Tennessee, they inject a young construction worker. He's told it's a new medicine. It's radioactive poison. The experiments are designed to measure plutonium retention and excretion. The Manhattan Project scientists need to understand how atomic workers might be affected by plutonium exposure. They want to know how long the element stays in the body. They want to know which organs absorb the most radiation. So they inject human beings and measure what comes out. The doses are massive. Some subjects receive 5 micrograms of plutonium, more than 40 times what researchers later determine is safe for a lifetime. The injections deliver radiation directly to bones, liver, and spleen. The effects are permanent. Most subjects die within months, though not necessarily from the plutonium itself. Their bodies are sometimes autopsied without family consent. Tissue samples are collected and stored. For decades, the families don't know their loved ones were test subjects. The experiments expand. At Vanderbilt University, pregnant women are given radioactive iron in vitamin drinks, told it's a health supplement. At the Fernald School in Massachusetts, mentally disabled children are fed oatmeal laced with radioactive tracers. Researchers tell parents the children are joining a science club. Over 70 children are fed radioactive material. In 1993, the Albuquerque Tribune publishes an expose. Reporter Eileen Wellsome uncovers documents about the plutonium injections. Her investigation reveals names, dates, and doses. The story wins a Pulitzer Prize. President Clinton forms the Advisory Committee on Human Radiation Experiments. The committee reviews decades of radiation tests. They confirm more than 4,000 radiation experiments on unwitting subjects. The government apologizes and pays settlements to some families, but the apologies come 50 years too late. The subjects are dead. Their families live decades without knowing the truth. The Plutonium Files stand as proof that American scientists were willing to poison their own citizens to gather data for the nuclear age. Project SHAD. In the 1960s, the Pentagon wants to test chemical and biological weapons. They need to know how effective these weapons would be in combat, so they spray their own sailors with nerve agents and deadly bacteria. Project SHAD, Shipboard Hazard and Defense, runs from 1962 to 1974. The Department of Defense conducts 112 tests. Dozens involve live chemical and biological agents sprayed on naval vessels. The sailors on board are told nothing. In one test, the U.S. George Eastman is sprayed with VX nerve agent, one of the deadliest substances ever created. A single drop on skin can kill within minutes. Sailors are exposed to determine if protective gear works. In another test, ships are sprayed with Bacillus glabigi bacteria to simulate anthrax attacks. The Navy tells sailors they're participating in training exercises. They're told the substances are harmless simulants. Many are ordered to remove protective equipment partway through tests. They're deliberately exposed. Decades later, veterans report cancers, respiratory diseases, and neurological disorders. They suspect the experiments caused their illnesses, but the military keeps Project SHAD classified. When veterans file for benefits, the Department of Veterans Affairs denies their claims. Without proof of exposure, they get nothing. In 2000, investigative journalists exposed the program. The Pentagon is forced to declassify documents. They admit to spraying sailors with chemical and biological agents. They admit to lying about the nature of the tests. They admit to exposing thousands of service members without informed consent. The VA begins reviewing claims, but records are incomplete. The military can't identify all exposed personnel. Many veterans die before receiving compensation. Project SHAD illustrates a grim reality. The military treated its own sailors expendable test subjects, exposed them to weapons designed to kill, then classified the evidence and denied everything for 40 years. Operation Midnight Climax. In 1955, the CIA opens a brothel in San Francisco. It's not for pleasure. It's a laboratory. The agency rents apartments in the North Beach neighborhood. They furnish them as high-end bordellos. They recruit prostitutes to lure clients. Once inside, the men are drugged with LSD without their knowledge. CIA agents watch through two-way mirrors, taking notes. The operation is a sub-project MKUltra. The goal is to test whether LSD can be used in sexual blackmail operations. Can drugged men be manipulated into revealing secrets? Can compromising photos be used for extortion? The Zorn wants to know. Federal agent George Hunter White runs the operation. He poses as a seaman or bohemian artist. He sits behind the mirror with a pitcher of martinis, watching drugged men interact with prostitutes. He records behavior. He documents reactions. He commits federal crimes while drawing a government salary. The agency expands the operation. They open another safe house in New York. They drug men in bars and restaurants. They test higher doses. They test combinations of drugs and alcohol. They create scenarios designed to shatter psychological defenses. The subjects have no idea they're part of an experiment. They're civilians. Many are married. Some are prominent in their communities. The CIA doesn't care. The men are test subjects, nothing more. Operation Midnight Climax runs until 1963. The CIA closes the safe houses when MKUltra wins down. No one is prosecuted. The prostitutes are never identified. The men who were drugged never learn what happened to them. In 1975, the Church Committee exposes fragments of the operation. The details are sparse because most records were survives to confirm the CIA ran drug-fueled brothels to experiment on unwitting Americans, violating laws they were sworn to uphold. The Stateville Malaria Study during World War II. Malaria is killing soldiers faster than bullets. The disease devastates troops in the Pacific. The military needs better treatments, so researchers at the University of Chicago infect prisoners with malaria to test experimental drugs. Starting in 1944, Dr. Alf Alving runs experiments at Stateville Penitentiary in Illinois. He recruits 441 inmates. The prisoners volunteer in exchange for commuted sentences or parole consideration. But the consent is hardly voluntary. They're incarcerated. They're offered freedom in exchange for fashion. Preachers inject prisoners with blood infected by Plasmodium parasites. The men develop malaria. They suffer high fevers, chills, and delirium. Some develop cerebral malaria. Some nearly die. The doctors test experimental drugs. Some work, some don't. When drugs fail, prisoners endure weeks of debilitating illness. Researchers measure the progression. They take blood samples. They document symptoms. The prisoners suffer for science. The experiments continue for 2 decades. Over 1,000 inmates are infected with malaria. Others are infected with dysentery. The prison becomes a testing ground for tropical diseases. The study produces valuable data. Researchers develop chloroquine and primaquine, drugs still used to treat malaria today. The treatments save countless lives. But the cost is borne by incarcerated men who had little choice but to participate. By the 1970s, ethical standards change. The use of prisoners in medical experiments is heavily restricted. The Stateville studies are cited as examples of coercive research. Informed consent requires freedom. Therefore, their consent cannot be truly informed. The malaria experiments saved lives. But they also exploited a captive population, offering freedom in exchange for infection, turning prisons into laboratories where the desperate traded their bodies for a chance at release. Guatemala Syphilis Experiments. In 1946, U.S. Public Health Service Dr. John travels to Guatemala. He has government funding and a disturbing plan to deliberately infect Guatemalans with sexually transmitted diseases to test the effectiveness of penicillin. Working with Guatemalan officials, Cutler recruits subjects from prisons, mental asylums, and orphanages. He promises treatment. What he delivers is infection. Researchers pay prostitutes infected with syphilis or gallard to have sex with prisoners. When that method proves too slow, they shift to direct inoculation. Doctors scrape men's genitals with abrasive material, then pour infectious bacteria into the wounds. They inject syphilis spirochetes directly into prisoners' spines. They drip gonorrhea bacteria into men's eyes. Over 1,300 Guatemalans are deliberately infected. 83 are children. Mental patients are infected without any ability to consent. Orphans are infected without guardians' knowledge. Some receive penicillin treatment. Many do not. Researchers want to know how long infections take to develop and whether early treatment is necessary. At least 83 people die from the experiments or related complications. Cutler keeps detailed records. He photographs infected genitals. He documents disease progression. He writes reports sent back to U.S. officials. The experiments continue until 1948, when Guatemalan officials grow concerned and shut down the program. The records are filed away and forgotten. For 62 years, the experiments remain hidden. In 2010, Wells College professor Susan Reverby discovers Cutler's archive papers. She publishes her findings. The revelation shocks the world. President Barack Obama personally calls Guatemalan President Álvaro Colom to apologize. The U.S. government admits the experiments were unconscionable violations of medical ethics. In 2015, survivors and families sue the U.S. government and Johns Hopkins University, which oversaw the research. A federal court dismisses the case, citing sovereign immunity. The victims receive no compensation. The Guatemala Experiments reveal that the Tuskegee study wasn't an isolated incident. It was part of a pattern. American researchers were willing to infect vulnerable foreign populations, deny treatment, and watch them die, all to gather data they considered scientifically valuable. Agent Orange testing on humans. Between 1965 and 1966, the U.S. Army tests Agent Orange on American soldiers. The military wants to know the effects of the herbicide before widespread deployment in Vietnam, so they expose service members without informed consent. At Edgewood Arsenal in Maryland, researchers apply Agent Orange directly to soldiers' skin. They patch test concentrations of the chemical on forearms and backs. They measure skin reactions. They take biopsies. The soldiers are told they're testing protective clothing. They're not told about dioxin, the deadly contaminant in Agent Orange that causes cancer and birth defects. The tests expand. At Fort Greely in Alaska, servicemen are sprayed with herbicide to test decontamination procedures. At military bases across the U.S., soldiers are exposed to herbicidal agents as part of training exercises. The exposure is deliberate. The risks are concealed. Years later, Vietnam veterans exposed to Agent Orange develop cancers, diabetes, and nerve disorders. Their children are born with severe disabilities. The military denies any connection. When veterans seek compensation, the VA claims insufficient evidence. But the human testing reveals the military knew Agent Orange was dangerous before spraying millions of gallons over Vietnam. They tested it on American soldiers. They documented adverse effects. Then they deployed it anyway. In 1991, Congress passes the Agent Orange Act, finally providing benefits to exposed veterans. But the admission comes decades late. Thousands of veterans have already died. Their families have already suffered. The Agent Orange tests demonstrate a recurring theme. Military researchers prioritize data over human welfare, exposing soldiers to toxic chemicals, recording the damage, then denying responsibility when those soldiers came home sick and dying. Operation Luck in 1957 and 1958, the U.S. Army has zinc cadmium sulfide over vast regions of the United States and Canada. The airborne particles drift over populated areas from the Midwest to the Atlantic coast. Millions are exposed. None are told. The military calls it Operation Luck, large area coverage. The purpose is to test how a biological or chemical attack might spread across North America. The Army uses zinc cadmium sulfide as a tracer because the particles fluoresce under ultraviolet light, making them easy to track. Aircraft fly missions across 6 states. They spray from the Canadian border to Oklahoma. The particles settle on cities and farmland. They're inhaled by residents. They contaminate crops and water supplies. The Army insists zinc cadmium sulfide is safe. But cadmium is a known carcinogen. It accumulates in organs. It causes kidney damage and lung cancer. Long-term exposure is toxic. Residents of exposed areas later report unusual health problems, higher rates of cancer, respiratory diseases, birth defects. But proving causation is nearly impossible. The military didn't track who was exposed. They didn't conduct health monitoring. The operation remains classified for decades. In 1994, the Army finally releases documents confirming Operation LACE. They admit to spraying millions of unsuspecting Americans and Canadians with cadmium compounds. They claim the doses were too low to cause harm. Independent health experts disagreed. No compensation is offered. No apologies are made. Operation LACE is simply acknowledged and dismissed. The operation represents the scale of government willingness to use civilian populations as test subjects. Not hundreds, not thousands. Millions of people were exposed to toxic particles without consent, all in the name of Cold War readiness. These 10 experiments spanned 4 decades of Cold War research. They targeted prisoners, soldiers, mental patients, minorities, and entire cities. The victims were chosen because they were vulnerable, because they could be silenced, because their suffering could be classified and denied. Some experiments produced scientific insights. Some treatments developed through these programs saved lives, but the cost was unconscionable. Informed consent is the bedrock of medical ethics. Without it, research becomes exploitation. Without it, medicine becomes torture. What's most disturbing isn't just that these experiments happened, it's how long they remained hidden. Decades passed before victims learned the truth. Files were destroyed. Whistleblowers were silenced. Lawsuits were dismissed on grounds of national security and sovereign immunity. These programs prove that oversight matters. Transparency matters. The phrase "trust us" is never enough when governments operate in secret. These experiments happened because there were no consequences. Researchers faced no criminal charges. Officials faced no prosecution. The institutions responsible suffered no penalty. The victims deserve better. They deserve consent. They deserve truth. They deserve justice. Most received none of these things. Comment below your city so I know where in the world you're watching from, and tell me which government cover-up I should investigate next.